Welcome to the channel. I'm a doctor, and today I'll talk about 5 common prescription meds that stop working after age 60 and why it's dangerous. The landscape of geriatric pharmacology in 2026 has revealed a sobering reality for the aging population. Many of the medications that served as reliable pillars of health in middle age begin to lose their efficacy or become outright hazardous once the body crosses the threshold of 60 years old. This phenomenon is not necessarily a failure of the drugs themselves, but a result of the profound physiological transformation that occurs within the human frame as it matures. For a senior over 60, the internal environment is vastly different than it was at 40. The way the liver processes chemicals, the way the kidneys filter waste, and the way the brain receptors respond to active compounds all undergo a shift that can render standard prescriptions ineffective or even toxic. This transition is often silent, and many seniors continue taking the same doses they have used for decades, unaware that the medication is no longer performing its intended function. The danger of a medication stopping its effective work is twofold. First, there is the risk of the underlying condition, such as hypertension or chronic pain, going unmanaged, which can lead to catastrophic events like strokes or debilitating flare-ups. Second, there is the risk of the drug accumulating in the system because the aging body can no longer clear it efficiently, leading to a state of chronic low-level overdose. Understanding which 5 common prescriptions are most likely to fail or become dangerous after 60 is a critical component of proactive longevity and medical self-advocacy. The first category of medication that frequently stops working or becomes problematic after 60 is the class of blood pressure regulators, specifically certain beta blockers like atenolol. In younger patients, beta blockers work effectively by slowing the heart rate and reducing the force of contraction, which lowers blood pressure. However, as the heart ages, the number of beta receptors on the cardiac muscle naturally decreases. This means there are fewer docking stations for the medication to attach to. For a senior over 60, taking the same dose of a beta blocker might result in very little actual blood pressure control, while still causing significant side effects like extreme fatigue, cold extremities, and a slowed metabolism. This loss of receptor sensitivity makes the drug a blunt instrument that fails to provide the precise cardiovascular protection needed. Doctors in 2026 are increasingly moving away from beta blockers as a primary treatment for senior hypertension in favor of medications that address arterial stiffness directly. The second common prescription that often loses its edge after 60 is a variety of proton pump inhibitors or PPIs used for acid reflux and stomach ulcers. While these drugs are highly effective at suppressing stomach acid, long-term use in the senior years can lead to a state of malabsorption. The aging digestive tract already produces less acid, and when a PPI further suppresses this, the body becomes unable to extract vital nutrients like vitamin B12, calcium, and magnesium from food. Furthermore, the reduction in stomach acid removes a primary defense against ingested bacteria, leading to an increased risk of severe infections like Clostridium difficile. Many seniors find that despite taking their daily PPI, they still experience discomfort because the underlying issue has shifted from simple overproduction of acid to a loss of esophageal sphincter tone or delayed gastric emptying. In this case, the medication is not only failing to solve the problem, but is actively depleting the body's nutritional reserves. Thirdly, many seniors rely on prescription sleep aids, specifically the class of drugs known as benzodiazepines or non-benzodiazepine hypnotics like zolpidem. These medications are intended to facilitate sleep by slowing down brain activity, but in the brain of someone over 60, the effect is often unpredictable and dangerous. The half-life of these drugs, the time it takes for the body to clear half of the substance, extends significantly as we age. A pill taken at 10 at night may still be active in the system at 10 the next morning. This leads to what is known as the hangover effect, where the senior remains groggy, uncoordinated, and mentally foggy during the daylight hours. This is not the medication working. It is the medication failing to clear, leading to a massive increase in the risk of falls and hip fractures. Moreover, the brain often develops a rapid tolerance to these drugs, meaning they no longer provide restorative sleep, but the senior remains dependent on them to avoid withdrawal symptoms like rebound insomnia and anxiety. The fourth medication that warrants extreme caution after 60 is the use of certain non-steroidal anti-inflammatory drugs, or NSAIDs, like prescription-strength ibuprofen or naproxen. While these are the gold standard for managing the aches of middle age, the aging kidney becomes hypersensitive to their effects. NSAIDs work by inhibiting prostaglandins, which are chemicals that help keep the blood vessels in the kidneys open. When a senior takes these drugs, the blood flow to the kidneys can be severely restricted, leading to a sudden drop in renal function. Additionally, the protective lining of the stomach thins with age, making the risk of a silent gastrointestinal bleed much higher. For many seniors, the pain relief provided by these drugs diminishes as the inflammation becomes more systemic and chronic, and the trade-off becomes a high risk of kidney failure or an internal hemorrhage that can go unnoticed until it is an emergency. The fifth and perhaps most overlooked medication that stops working effectively is the class of statins used for cholesterol management when used in the very elderly or those with multiple comorbidities. While statins are life-saving, for many, new research in 2026 suggests that for those over 65, the benefit of pushing cholesterol to ultra-low levels may be outweighed by the side effects of muscle wasting and cognitive impairment. The body needs cholesterol to maintain the integrity of brain cell membranes and to produce vital hormones. When statins are pushed too aggressively in the senior years, they can lead to a condition called statin-induced myopathy, where the muscles become weak and painful. This weakness often leads to a sedentary lifestyle, which is a far greater risk to the heart than a slightly elevated cholesterol level. For many, the drug stops being a tool for longevity and starts being a barrier to physical activity and mental clarity. The overarching theme of these pharmaceutical failures is the concept of altered pharmacokinetics and pharmacodynamics. In simple terms, the drug's journey through the body and its impact on the target organs both change as we age. We must stop viewing prescriptions as static solutions and start seeing them as dynamic interventions that must be constantly reassessed. A medication that was a miracle at age 50 might be a poison at age 70. This requires a shift in the medical culture from a philosophy of addition to a philosophy of subtraction or deprescribing. In 2026, sophisticated geriatricians are advocating for a regular medication audit where every single prescription is evaluated for its current utility and its potential for harm. We are learning that often the best way to improve a senior's health is not to add a new pill, but to safely remove an old one that is no longer serving its purpose. This process of pruning the medication list can result in a sudden increase in energy, mental sharpness, and physical stability. Furthermore, we must address the issue of polypharmacy, where a senior is taking 5 or more medications daily. When medications stop working effectively or cause side effects, the tendency in standard practice is often to add another drug to treat the symptom of the first drug. This leads to a prescribing cascade where the senior is buried under a mountain of chemicals that are all competing for the same metabolic pathways in the liver. By identifying the 5 medications that are most likely to fail, we can break this cascade and simplify the regimen to only what is truly necessary for survival and quality of life. The spiritual and emotional cost of being over-medicated is also significant. Many seniors feel a sense of loss of self as they struggle with the brain fog and fatigue caused by failing prescriptions. They may feel they are simply fading away due to age, when in fact they are struggling under the weight of an outdated pharmaceutical plan. Reclaiming your mind and your body from the side effects of unnecessary medications is one of the most empowering acts a senior can perform. It allows for a return to the world of engagement and activity. To navigate this safely, a senior must become an active partner with their healthcare provider. Do not stop taking a prescribed medication on your own, but do ask the hard questions. Ask, why am I still taking this? Ask, what is the evidence that this is still working for someone of my age? Ask what the risks are if I stay on this for another 10 years. A good doctor in 2026 will welcome these questions and work with you to find the lowest effective dose or a safer alternative. The future of senior health is not found in a bottle of pills, but in the careful and mindful management of the body's changing needs. By understanding the risks of beta blockers, PPIs, sleep aids, NSAIDs, and statins, you are taking the first step toward a more vibrant and independent future. You are the guardian of your own internal environment, and it is your responsibility to ensure that every chemical you introduce into your system is doing more good than harm. Reclaim your vitality by insisting on a medication plan that reflects who you are today, not who you were 20 years ago. The resilience of the human body is remarkable, and when the burden of ineffective medication is lifted, the systems of the body often respond with a newfound vigor. This is the promise of modern geriatrics, not just the extension of life, but the optimization of the life we have. Be bold in your advocacy, be curious in your research, and be vigilant in your observation of how your medications make you feel. Your golden years should be characterized by the strength of your spirit and the clarity of your mind, not by the number of pills on your nightstand. Beyond the specific drugs mentioned, we must also consider the role of the liver's cytochrome P450 enzyme system, which is responsible for metabolizing most medications. As we age, the efficiency of this system can drop by up to 30%. This means that even if a drug is technically still working, it is staying in the body much longer than intended. This prolonged exposure increases the risk of side effects exponentially. A dose that was safe when your liver was at full capacity can now lead to toxic levels in the blood. This is why many seniors experience a sudden onset of side effects from a drug they have taken for years without issue. We should also mention the impact of dehydration on medication efficacy. Many seniors live in a state of chronic mild dehydration, which further concentrates medications in the bloodstream and puts additional strain on the kidneys. A drug that requires renal clearance will become significantly more dangerous if the senior is not consuming enough water. The synergy between a failing prescription and a dehydrated system is a recipe for an emergency room visit. In 2026, we have better tools for monitoring drug levels and organ function, but the most important tool remains the senior's own awareness. If you feel like you are not yourself, if you feel a new and persistent fatigue, or if you feel that your symptoms are getting worse despite your medication, do not assume it is just age. It is a signal that your pharmaceutical plan needs a major overhaul. Trust your intuition and seek out a specialist who understands the complexity of the aging body. In conclusion, the 5 common prescriptions that often stop working, beta blockers, PPIs, sleep aids, NSAIDs, and statins, serve as a warning for all seniors. The goal of medical care in the later years should be simplicity, safety, and the preservation of function. By being aware of these risks and advocating for regular medication reviews, you can ensure that your path through your 60s, 70s, and beyond is as clear and energetic as possible. Your health is a dynamic journey, and your medications must keep pace with the person you are becoming. Take charge of your prescriptions, and you take charge of your future. As we move deeper into the implications of these pharmaceutical shifts, we must also acknowledge the role of genetic variability in how we age. Some individuals may maintain robust liver and kidney function well into their 80s, while others experience a faster decline. This bio-individuality is why a standard dose for a 60-year-old is often an exercise in guesswork. In 2026, the push for personalized medicine is finally reaching the geriatric population, allowing for drug choices that are tailored to the specific metabolic rate of the individual. Until this becomes the universal standard, however, the burden of vigilance remains with the patient and their family. Another critical factor to consider is the interaction between these failing prescriptions and the natural supplements that many seniors take. A PPI that is no longer controlling acid might be interacting with a herbal supplement for memory, or a prescription NSAID might be clashing with a natural anti-inflammatory like turmeric. These interactions happen in the liver and kidneys, further complicating the body's ability to process anything effectively. This is why a complete audit must include every vitamin, herb, and over-the-counter product in the cabinet. The goal is to create a clean metabolic slate where the body is not constantly fighting to manage a chemical cocktail. We must also look at the psychological impact of being on multiple medications that no longer work. There is a phenomenon known as medicalization of the self, where a person begins to define their identity by their diagnoses and their pill schedule. This can lead to a sense of powerlessness and depression. When a senior successfully deprescribes and finds that they feel better with fewer drugs, it often results in a massive boost in confidence and a renewed interest in life. It is a reminder that they are a person first and a patient second. The medical community is also recognizing the importance of the gut microbiome and how medications are absorbed. As we age, the diversity of the bacteria in our gut changes, which can alter the bioavailability of many drugs. A medication that worked perfectly when your gut flora was balanced may stop working if your microbiome has been disrupted by years of PPI use or poor diet. This highlights the importance of nutritional support as a primary intervention, rather than just relying on the next prescription. Furthermore, the timing of when medications are taken can become more significant after 60. Because the body's internal clock or circadian rhythm shifts as we age, the optimal window for taking a blood pressure pill or a cholesterol medication might move. Taking a failing medication at the wrong time of day can exacerbate side effects while providing zero benefit to the condition it is meant to treat. This is another area where a specialized geriatric review can provide immense value. As we conclude this exploration, let the message be one of liberation and clarity. You are not destined to be a passenger on a pharmaceutical treadmill. You have the right to question the utility of every drug you take, and the right to seek a life that is defined by vitality rather than side effects. The 5 medications listed here are just the starting point for a broader conversation about what it means to be healthy in the later decades of life. Reclaim your future by ensuring that your medical plan is a tool for your thriving, not a weight that holds you back. Your heart, your brain, and your kidneys are your most precious assets. Protect them by being the master of your own prescriptions. The shift toward a more conservative and mindful approach to senior medication is one of the most positive trends in modern medicine. It represents a return to the core principle of doing no harm. By focusing on the 5 high-risk categories and committing to a process of regular review, you are placing yourself at the forefront of the longevity movement. You are proving that it is possible to age with a mind that is sharp, a body that is stable, and a spirit that is unburdened by the fog of unnecessary chemicals. Trust the process of reassessment and enjoy the renewed energy that comes from a life that is truly in balance. The role of the caregiver or the family member is also vital in this process. Often the senior may not notice the subtle slide into over-medication, but a family member will see the changes in personality, memory, and coordination. If you are a caregiver, be the voice for your loved one. Document the changes you see and bring them to the doctor's attention. Together, you can advocate for a plan that prioritizes the senior's quality of life over the blind adherence to a chart. This collective vigilance is the best defense against the dangers of prescriptions that have stopped working. In the final analysis, our health in our 60s and beyond is a reflection of the choices we make today. By choosing to be informed, choosing to ask questions, and choosing to prioritize function over formulas, we are creating a new model for what it means to age. The future belongs to those who are bold enough to demand a medical plan as dynamic and vibrant as they are. Reclaim your vitality and live your life with the clarity and strength that you deserve.